Hi, my name is Angela Tekowski, and welcome to my presentation on query and documentation. In this presentation, we will discuss the 7 criteria for quality documentation, 4 patient charts that demonstrate quality documentation and also need some work, and the importance of proper medical documentation, and then some suggestions on how to properly query a provider for missing information. In order to accurately bill and code procedures from a patient chart, there are 7 bits of criteria that need to be met within the chart. They need to be precise, legible, consistent, complete, clear, timely, and reliable. Let's take a look at outpatient clinic case 410057. This is a patient chart where the patient has cancer of the right breast. What went right? The primary diagnosis code and the reason for visit codes seem to match the case's clinical documentation accurately. What went wrong? The secondary diagnosis code does not have supporting documentation, and a query to the coder might want to look into this case again. Let's take a look at outpatient clinic case 410092 now. This was a case of a benign neoplasm of a person's colon. So what went wrong? There are 2 different dates for when the colonoscopy was performed. One said it was performed on April 11th, and one said it was performed on June 11th. That's a discrepancy, and you need to know when those were done so you can have a baseline where to start the treatment from. Primary diagnosis code is incorrect and should be listed as a C18.9, malignant neoplasm of colon, unspecified, and the corresponding ICD code can be found on page 7 of 11 in the report. What went right? The rest of the diagnosis codes are correct. All right, let's take a look at outpatient clinic case 410098. This was for 2 epidermal cysts that were removed from a patient. And what went right? The reason for the visit and the primary diagnosis codes were correct. What went wrong? I wouldn't have coded the hypothyroidism since it's not what she was there for. I didn't feel that it was necessary to do. At outpatient chart 410096. This was a dental encounter for a patient with learning in intellectual disabilities. It turned out he actually had Asperger's syndrome according to the chart. I work in the dental field, so this chart gave me a little bit of a run for my money. There were no extractions that took place, and that was listed in the HCPCS codes. The different filling codes needed to have the surfaces that were filled and how many for each tooth. And then a comprehensive periodontal charting evaluation was listed, and there was no indication that that was done either. I would have just listed a regular old either new patient exam or existing patient exam. Okay, I'd like to take a second and talk about what went right with this chart. First off, the diagnosis code for intellectual disabilities was correct. However, he had Asperger's syndrome, not autism. And the rest of the diagnosis codes seemed to be listed correctly. What went wrong? The HCPCS codes were off. The documentation never indicated that what surfaces for the amalgam and the composite fillings that were done. A full mouth series was completed and was not listed. An extraction was listed and did not happen. And the endodontic therapy that was performed was not listed. That should be listed as a D0330. An exam level code of a D0150 could have been utilized instead of the code for the periodontal exam that they used, since there was no mention of periodontic charting. So let's talk about how we can appropriately query a provider. When sending a query to a provider, if you follow these guidelines, you'll convey your message and keep compliant. Keep your query concise and clear. Contain clinical indicators from the health record. Present the facts. Do not include any unnecessary data or extras. And do not indicate a reimbursement status or quality of documentation. We don't want to sway the providers into giving more or less information depending on how much the facility will receive in their payments. So why is quality documentation so important? We've talked about it so many times while I've been studying this subject. First off, it helps to give the patients the best possible care in the future by painting a picture of what has already been done. Services in the area are made more readily available if the actual need is accurately documented. Easier workloads for coders and providers, less workflow. Less time is wasted resubmitting claims. Facilities are accurately paid for the goods and services rendered. And less insurance claim denials. Here is my bibliography. I do thank you for watching my presentation, and I hope you have a great night. Thanks. Bye-bye.